Well, good afternoon, everybody. I'll get Dr. Morrison and Marion to give their regular update here in a moment. I just wanted to begin just to talk about an issue that's of, I'd say, of primary concern to many, many Islanders, and that is the child care situation that we are dealing with now that we are beginning to get our economy back in operation as we work through the phases of our Renew PEI Together plan. So right off the bat, this is a very difficult issue, and it is one that we need to tackle head on, and we have been tackling it head on. The way we have dealt with this important issue of childcare in the past has now changed, obviously. The physical distancing and other health directives that are going on right now are going to result in smaller groups and classes, obviously. And we also know that we have the added reality that we now have thousands of students who aren't in school, but many of them will need to be cared for. And they are in need of social interaction, physical activity, to play games, and to just be kids. So we need to provide social and recreational opportunities for our children and youth, and to provide safe, caring environments for parents and guardians to send their children as they begin to get back into the labor force. And this is going to require us to be innovative. It's going to require all hands on deck. We're going to need the ECDA. We're going to need NGOs like the Boys and Girls Club, like Murphy's Community Center, UPEI, Holland College, and the Bell Alliance Center, and so many of those island-wide who have been specializing in before and after care for school all across the province. We know that we have to change how we deliver programs. Also, where some of these programs have been traditionally delivered will need to change as well. We know we will need to provide more space, and that is why we will make our schools available across Prince Edward Island to those who will need them to provide that extra space. We are very fortunate to have ECDA, the Early Childhood Development Association, which primarily focuses on children between infancy and 5 years of age. They have been absolute champions in these difficult times, providing child care to essential workers across the province. We continue to work with ECDA to make sure Islanders will have access to affordable and high-quality child care opportunities for this very important demographic, and to do so in knowing that the public health directives have changed how these businesses will need to operate. For those school-aged children who would typically need full-day, wouldn't typically need full-day programming until the summer months when school lets out, we know that some and many of those will now require it for a longer period of time. As I mentioned earlier, these programs have often been provided by nonprofits and community organizations across PEI. So government is working to identify and remove the barriers that exist, to allow these and other organizations to adapt, and to provide quality programming for children and youth as soon as possible. So as we move safely into these next phases of the Renew PEI Together plan and we begin to slowly reopen our economy, we do so in knowing that child care and daycare should not and must not be a barrier to returning to work. So let's just deal with what we know. There are over 850 kids from almost 500 families in the essential workforce who have been utilizing emergency child care services in the province for these past few months. We know that there are about 18,000 children in PEI age 0 to 12. So pre-COVID, 6,150 of these kids would be in early childhood centers. 2,296 in school-age care, which would be before and after school. And we also know that there are about 300 unlicensed providers providing care to about 1,500 kids. So post-COVID, parents, guardians, and kids, we know, have shown tremendous resiliency. Like all Islanders, their lives have been dramatically impacted, turned upside down, but they have been finding a way through. And as we move into the next phases of our economy opening up a bit, Islanders will be returning to the workforce, and as I say, will require child care options. And we know those numbers will be much higher than before. We are asking, and we know employers will be as flexible as possible as we navigate our way back. And our early efforts so far have been positive. On May 22nd, we will see an additional 1,100 spaces for early childhood centers as we increase the number of centres that will be open from 22 to 155. The 300 home-based care providers in PEI as of last Friday can now take up to 7 school-aged children in their homes, which will make more spaces available to about 2,100 island kids. So as I say, while this is a good start, there remains a growing need to have more spaces provided. That's why we're working with the PSB and the CLSF to make school facilities available so we can create more capacity, and which will help make up for some of the capacity we have lost due to the change in services required by the CPHO directives. Chief Public Health Officer Dr. Morrison and her office will continue to work with day camp providers to be ready for further capacity in the days ahead. And we know one of the first questions, probably the most important questions, is about money and cost. In the beginning, our government stepped up and we provided emergency childcare at reduced or no cost for essential workers. And as we lead into phase 2 and we see the expansion of our population that requires care, we will begin to reinstitute some parents' fees, but we will do so on a gradual phased-in basis. From phase 2 on May 22nd until June 26th, which would be the official end of the school year, we will provide $75 per child per week towards childcare. So for those who attend licensed centres, the money will go directly via stipend to those individual ECCs. For those who access private childcare solutions, you can apply to be reimbursed this amount through the Department of Education and Early Learning. We know this is a most difficult challenge, that there are many, many questions. We are working together not just to find answers, but in some cases to create solutions, because as we have been living these past few months, the times demanded. Minister Trivers and staff will be announcing more and in greater depth details on that issue on Friday. Finally, I wanted to just take a second to talk about where we're at by looking a little bit about where we've been, with the hopes that maybe we can better understand where we need to go. On March 13th, PEI, the world as we know it, stopped. Uncertainty and fear surrounded us. Since then, we've had to alter how we act, how we move, and how we operate. Through planning, through hard work, perhaps a little bit of luck, we have not only bent the curve here, as Dr. Morrison has said a number of times, we've worked to ensure there isn't one. What we've had to do has certainly been difficult and uncomfortable for all of us. It is not in our nature to not be welcoming, to be cooped up inside our houses and not to be socializing. And while we've had to change so much of how we live, we can't let that change who we are. As proud Islanders, as proud Canadians, we can't let the circumstances of the past 8 weeks change our character or change how we treat one another. We have been saying for weeks that we can't live like this forever. We have to begin to learn to live in this new environment. And we are looking at ways to open safely, cautiously, to open our province, to make that long road back so we can be who we are, that is proud Islanders and welcoming Islanders. And I'm very proud to sit here and say that as Premier, that over these past number of weeks we have seen the very best of Islanders on display many times. But I would be less than honest if I didn't point out that we have seen, sparingly, the opposite as well. When I hear reports of people in this province being followed and threatened, to see staff at our points of entry being recorded, I'm saddened and I'm disappointed. And I know we can do better. I know that we are so much better than this. So let's remember, this has been difficult, this has been challenging for all of us. Fear and uncertainty have encapsulated our lives for so long. But let's remember why people want to live here. Let's remember why people want to come here. And let's remember why people all across this country know that this is the best province to live, work, and raise a family in. So with that, Dr. Morrison, I'll pass it on to you.
Thank you, Premier. Good afternoon. I do think it's fitting that as we talk about renewal and easing up our measures, it's a time for reflection as we make steps into spring. And it's a time to make steps to move forward together. 7 billion people around the world have been impacted and have put their lives on hold in many ways for the last couple of months, and we're all trying to figure out together how we move on, but move on in a different way. Across Canada, now there are more than 71,000 cases and more than 5,000 deaths. There are no new cases of COVID-19 in Prince Edward Island. We do have another 264 new negative tests since Monday. All individuals entering PEI are required to self-isolate for 14 days upon arrival, and we've talked about that many, many times. And if people are unable to self-isolate away from others in the household, the entire household must self-isolate for 14 days. And this includes our essential workers. And essential workers include those traveling from outside the province, going back and forth for work that is considered essential. Essential workers include, but are not limited to, construction, healthcare providers, transportation of goods and services, workers in the energy sector, fisheries, agriculture. And many of these essential workers who are going back and forth were never getting out of self-isolation in the last couple months. And it was very challenging, both for the essential worker and their families. So going forward, essential workers traveling off-island frequently within Canada and the United States can be tested regularly for COVID-19. And if they are to be exempt from self-isolation, essential workers will have an option to be tested when they enter the province, and if they're still in the province, again at 7 days. This does not apply to long-term care staff who must continue to self-isolate for 14 days. A number of questions, and just want to be clear about, as lobster season is approaching, during lobster season, all islanders are reminded that all commercial wharves where there are landings of lobster and other products will be closed to the public until otherwise advised by our office. Unlike other years, there will be signage to ensure that everyone keeps their distance from fishers and buyer stations on the wharves. I know that many islanders have loved ones in long-term care facilities across the province, and it is so difficult to be physically apart. And although we have found ways to connect virtually and otherwise, it does not replace being together in person for those who we love and care for. So we are closely looking at the long-term care visitor restrictions that are currently in place and where there may be room for policy changes. And I also know that Health PEI is looking at not only long-term care, but their visitor policies in acute care facilities as well. And I hear every Islander's concern about this issue, and I share that concern. Across the country, we see many situations where COVID-19 has overrun long-term care facilities. And a large percentage, 82% of the deaths in this country have been related to long-term care and senior residences. So we are very cautious with this population and want to ensure we are doing everything to keep them safe. And on that note, really effective yesterday, staff working in long-term care settings are not going to be working in multiple healthcare facilities. So another area of concern, and I know many are worried and concerned about when and if we'll see an increase in cases, outbreaks, and what a second wave could look like here in PEI. I am equally concerned, and I spend a lot of time being concerned about what this could look like and what this means. The Premier has outlined the Renew PEI plan together, and it is a chance for us to open up our businesses and our lives cautiously and without too and not too quickly. And I'd encourage Islanders also not to change their behavior too quickly. It's not like a light switch that we can turn on easily on and off, but it's rather when we talk about if we open up the floodgates, it's so much harder to close that, and much more challenging. We know there will be lots of questions. There are a lot of questions every day, and we don't have all the answers. But we are trying to make the best decisions we can with the public in mind and the population's health, and to minimize the risk. So, and I say every day, I ask for patience, the kindness and calmness as we navigate this together. Thank you.
Thank you and good afternoon. We continue to carefully monitor the COVID-19 situation in PEI as well as our health services that are delivered, especially as more services like some elective surgeries are now happening on PEI. Part of our work now is returning the management of services of the regular health to the regular health PEI administrative structure from our joint response team. And Health PEI and the Department of Health and Wellness are working together with a services reinstatement team to restore health services to a new state of healthcare delivery on PEI. This team will consider the needs of patients and weigh any risk of reintroducing services as we continue to be prepared for any surge in patients requiring care. It's important to manage our expectations as we reintroduce some services and to let people know that our initial focus is on high priority appointments and procedures specifically related to cardiac or cancer care and prevention. These services, as well as urgent and emergency situations, will be reestablished first. It will take some time before our services approach our pre-pandemic levels. We're talking about weeks and months before returning to a new normal operational level. The impact of COVID-19 in some areas will be long-term on how we provide services, both due to the increased need to separate patients to maintain physical distancing when possible, or the need to maintain supplies and medications that are continuing to face some supply chain pressures. Other areas of our system have seen great innovations through this pandemic, and one example is virtual care, which has actually allowed an improved service level in some locations. These innovations that were born out of necessity will be reviewed as well to see what can remain as we move to this new normal state of healthcare. Exercising restraint and a careful balance in our reinstatement of services is critical as we take a whole system approach to ensure we have what we need to provide the most urgent services. Anyone who is being rebooked for a procedure or appointment as we bring services back will be contacted by Health PEI or your healthcare provider, and there's no need to call and rebook your appointments. I want to remind Islanders that we continue to recognize the need for mental health and addiction services during the pandemic and remind you of a number of services that are available. The Child and Youth Urgent Mental Health Care Service is now available for children and youth under the age of 18. That can be accessed through a toll-free number of 1-866-833-5443, and the hours are 12 p.m. to 6 p.m. daily. Trained mental health clinicians and with Health PEI will provide a thorough risk assessment, some stabilization, as well as connecting those Islanders to local community supports for children and youth. Adults can access information and services around mental health and addictions via the response line by calling 1-833-533-9333. Calls for this service will be answered as well by trained mental health and addiction staff from Monday to Friday and 8 to 4. People who require acute mental health admission or services will be directed to psychiatric urgent care clinics located both at Hillsborough Hospital and Prince County Hospital, and anyone requiring emergency medical stabilization will still be seen at the emergency departments as usual. Other mental health information and services are available by visiting the government website of princeedwardisland.ca/COVID-19 and clicking the icon for mental health supports. The cough and fever clinics and screening clinics continue to run 7 days a week, both in Charlottetown and Summerside. Yesterday, we saw 73 patients in Charlottetown and 23 at our Summerside clinics. A reminder that these are available to anyone who has symptoms such as a new cough, fever, sore throat, runny nose, or unexplained fatigue, and contact your family doctor or nurse practitioner's office or call 811 to arrange an appointment at the cough and fever clinic. When you arrive at the clinic, just a reminder to remain in your vehicle until you're notified by staff to come inside for your appointment. Thank you again to all Islanders who have supported our health system in this response, whether it's through physical distancing or providing essential services that have supported our staff and our workers. Thank you.
Thank you very much. With that, I will turn it over now to our friends in the Island media to take some of their questions.
Nicole Williams, CBC.
Hello, everyone. This question is for Premier King. I'm wondering if you can elaborate a little bit more on what you're hearing about people being followed and threatened and staff at points of entry being recorded. What have you been hearing, and what do you make of all this?
Well, I mean, it's certainly isolated cases, I'm sure, but I think I felt it was important to address it from just a humane island perspective. I think that, you hear things about the people being asked to leave a store because they look like a temporary foreign worker. To me, is offensive to me as an Islander. It's offensive to me as a Canadian, and it's certainly disappointing to me as a Premier. I mean, if there's one thing I know about COVID-19, it doesn't care much about the color of your skin or the language you speak. And I just think that in these difficult times, we've seen the very best of Islanders, and at other times we've seen us maybe go to a place where we don't normally go, and I just want to encourage Islanders to remember who we are. We are an open, welcoming society. We're wonderful people who care about others, and we have to remember that now more so than ever.
Thank you. And I'm wondering if you can also elaborate a little more on what we heard from Minister Thompson said yesterday, that there are investigations into possible stowaways coming in over the Confederation Bridge. I'm wondering if you have any more information to share about that.
I don't, other than what Minister Thompson shared yesterday. A lot of these information that gets passed on to us sometimes would be rumor mill, some would be based on fact. So I don't think we have any more information than what Minister Thompson shared yesterday. But I do know that over the course of the last 8 or 9 weeks, there have been numerous incidents raised on social media and otherwise that turned out not to be accurate. Not saying that that is the case in this regard, but the isolated incidents that the minister is looking into, I will make sure he passes on more information as it becomes available.
Thank you.
Thank you.
Louise Martin, CBC.
Hello, good afternoon to you both. My first question is for Dr. Morrison, please. So there's some new guidelines for essential workers coming to PEI. Can you explain exactly who now can become exempt from self-isolation and how the testing will work? Is it similar to what was announced for truck drivers and that you would call ahead and get an appointment? Can you just walk us through a little bit of that? Thanks.
Hi, Louise. So yes, as you know, the information about the truckers as essential workers, we talked about in the last couple of days, but these would be for other essential workers, and they, for the most part, would be, if they're going back and forth and really wanting to be out of that self-isolation, would be tested on arrival, likely at the cough and fever clinics, and then they would also then get a repeat test at 7 days. They would stay self-isolated until that first test comes back negative. So they will remain in self-isolation until the first test comes back negative. Then they will get a repeat test at 7 days. And I think these are additional measures. Some of these essential workers are considered exempt in other provinces. We are wanting to be extra careful with here in Prince Edward Island, and regular testing is something that we are able to do, and I think is a good measure to be put in place. And the information is certainly going out to different sectors of essential workers, and we'll be operationalizing that just like we did for the trucking industry earlier in the week.
For Premier King, and it's back to the issue of daycare. Premier King, we're about, I think, 9 days now away from phase 2 when daycares were told that they were allowed to open their doors. So how quickly can you make all of this happen? Will there be childcare available in schools at the start of phase 2? And, what's your advice to parents out there who are feeling awfully anxious right now about returning to work and not having the appropriate level of childcare?
Yeah, well, thank you very much, Louise. And it is a concern, not just for parents, but for all islanders. I think we are in a very uncertain time, and we're trying to deal with things that we've never had to deal before, and we have to do it at breakneck speed, for sure. I am very hopeful that we have an all-hands-on-deck approach. We have many people who are digging in, and that isn't just from a government perspective, that's from all across the board, all across some of the sectors that I outlined in my opening address. We do recognize the challenges, we do recognize the need and the added burden that is now on the system because of the school-age children who will be requiring care that wouldn't normally have needed that. So we're stepping up. We do know that it will take some time, but I feel better today than I did yesterday, to be quite honest, and I think as the days roll on, we will hopefully continue to see that progress. But it is a big undertaking, and like many issues we've been dealing with for these last 8 or 9 weeks, there are many more questions than we have answers for right now. But we're working like heck to try to find them, for sure.
Okay, thank you so much.
Stu Neepy, The Guardian.
Hi, good afternoon, everyone. I suppose this is a question that could be addressed by either Dr. Morrison or Premier King, but there are no doubt some parents who might question whether or not it's completely safe, I guess, to sort of re-enroll their children back in daycare at this point. So, I understand, I guess, there seems to be a need to sort of get people back to work, but what assurance can you give that re-enrolling children in childcare at this stage is a safe thing to do for parents?
You want to take the first part of that? From here.
Hi, Stu. So I think we've had the childcare facilities for essential workers have already been underway for a number of weeks, and so some of the guidance that was used in those childcare settings for the essential workers, very similar to what is going to be in place going forward. Trying to make sure the people working are safe, as well as the children, and lots of certainly as part of that is the smaller numbers that are challenging, but it's about staggered entry. It's about the really important screening of both staff and children before they even get into to the facility. It's about the enhanced cleaning. It's about trying to maintain physical distance where possible, and of course it's a different environment, and we're certainly seeing this being done in other places right across the country. We're looking at guidance right across the country. We have been working with early childhood to help address the questions as much as possible. And and certainly appreciating that the evidence around our children in this country and the impact of COVID-19 has been much smaller. Having said that, we don't want to minimize that at all, and we are putting all these measures in place because we're still paying attention to that risk. So I hope that helps, Stu.
Okay, and I guess just as a follow-up, you'd mentioned the current guideline for long-term care staff is that they cannot at this point work in two different facilities. Presumably, most long-term care staff who do, are doing it because they probably don't have full-time hours at one or the other facility. But is there any kind of economic compensation for long-term care staff who are now prohibited from working one of their jobs due to this rule?
Yeah, well, I think, one of the things that we outlined here in the last few days was assistance to help those in that sector make it easier to make the employees make the choices that they need to make. But I do think we need to continue, and we will be continuously reevaluating that. I think you're exactly right. Many people who would work in that sector would work 10 hours at one facility, 12 at another. And it's probably because they've been chasing some hours at each of those locations. So I think we're asking them to make a decision to pick one, obviously. But there will need to be programming in place if there isn't, to make sure we, like we have with most all other islanders during this time, is if we can't make them whole, try to do the best we can to help them as we work through this difficult time. Heather, do you have some more? Yeah, sure. Yeah.
I just might add to that, Stu, that there's been a lot of work with the HR team and Marion HR team, as well as Health PI, and work with the department with private long-term care as well, to try to make sure that the information's there and that there is an HR plan to make sure there's staff available. And of course, just to mention, there are some exemptions or exceptions to that. For instance, physicians, there may be a physician who looks after more than one long-term care facility, and of course that would be able to continue. And there are a number of those exemptions.
Okay, thank you.
Great.
Thank you.
Carrie Wynn McLeod, Ocean 100. Carrie Wynn McLeod, Ocean 100.
Good afternoon to everyone. My first question would be for Dr. Morrison. You mentioned about the wharves will be closed to the public and only workers, industry people should be there when lobster fishing gets started. I'm just wondering, the other protocols that would be available that would be in place for the wharves and the processing facilities and the vessels. Can you tell us what other protocols are there and the details on each of those?
Hi, Carrie Wynn. So there's been information through the different sectors on the vessels and on vessel and then also with the seafood processing. Both of those quite extensive details, and they are both available online. I think we actually had to look for the vessel one. I had to look for the vessel one myself yesterday, but I think both are available, and they have gone out working actually with the industry. So they've been distributed. I think there would be the same principles as with anywhere else, trying to maintain physical distance where possible, understanding that there's always, that's a challenging environment, so that's why there's particular guidance out for that sector. Enhanced cleaning, looking at different administrative and physical controls that you could do to minimize risk, and also the screening that we talk about. I mean, if people are not feeling well, they shouldn't be on the wharf, on the boat with other people. So certainly through the guidance, those same really important principles apply, and those are the public health measures that you'll see through all the guidance. So I think. These are based not only on what's happening here in PI, but these guidance documents would look similar in various parts of the country where Nova Scotia, Newfoundland as well.
Okay, thanks. Let me check those out online. My second question is for the Premier. Mr. Premier, you mentioned, I think probably 2 weeks ago, about possible an earlier start for the operation of Northumberland ferries. Where are we at with that right now?
Well, thank you very much, Carrie Wynn, for the question. I think you will be seeing an announcement later today, if it's not already out, that the ferry service will begin on Friday, May the 15th to essential traffic, I believe, Heather, is what maybe we settled on? You're not at liberty to say?
I know we've had conversations certainly with Nova Scotia and Transport Canada, and I think it's just we also want to make sure that the screening is available at the and ready at the ferry, just as it would be similar to the bridge. So I think those are just the final details that are being worked out.
So unofficially, May 15th.
Laurent Rigaud, La Voix acadienne.
Good afternoon. Une question pour vous, Dr Morrison. Est-ce que vous pouvez faire un point sur l'épidémie au niveau du Canada? Est-ce que ça se stabilise? Est-ce que le nombre de cas quotidiens est en baisse? Quelle est l'évolution aujourd'hui?
Bonjour Laurent. Alors, partout au Canada, même si on sommes rendus à plus de 71 000 cas et plus de 5 000 morts, le nombre de cas commence à stabiliser. Et pour la semaine qui s'est passée, on n'a pas de nouveaux cas au Nouveau-Brunswick, l'île du Prince-Édouard, Terre-Neuve, les territoires et au territoire. Alors, c'est aussi un signe que ça commence à améliorer.
OK. Et juste un follow-up sur ça. Le nombre de morts aujourd'hui au Canada, c'est à peu près 7% de toutes les personnes qui ont été contaminées. Est-ce que vous pensez que ce chiffre est réaliste ou est-ce que le vrai nombre de personnes contaminées est en réalité beaucoup plus important, mais ils ne sont pas détectés?
Alors, je pense qu'il y en a plus de cas j'imagine, et peut-être ils n'ont pas eu des symptômes, mais je pense qu'on va apprendre de plus en plus à propos du vrai nombre quand on commence à faire les tests d'immunité dans les mois qui suivent. Mais le nombre de morts est très important. Le nombre de personnes qui sont à l'hôpital sont très importants parce que ça montre le nombre qui sont tellement malades ou morts. Et puis, c'est ces nombres-là qui, pour moi, sont vraiment les plus importants parce que on sait pour certains ces nombres, mais il y en a des cas peut-être qui sont plus nombreuses que 71 000 au Canada.
Merci.
François-Pierre Dufour, Radio-Canada.
Good afternoon to you all. I will ask my question in English for Premier King and Dr. Morrison. If you want to add or complete in French, that would be greatly appreciated. So this morning, the member of the National Assembly of Quebec for the Magdalene Islands made a formal request to the Quebec government to enter negotiations with PEI and New Brunswick in order to create a safe corridor for Quebecers who come through to the Magdalene Island ferry in order for them to be able to cross into their archipelago during the summer. I'm wondering, Premier and Dr. Morrison, would this be something that the province of PEI will be looking at, such negotiations? And from a public health perspective, is that safe to do given the number of cases that are still up in Quebec?
Well, let me answer the first part, and then Dr. Morrison could answer the second. That I'm not aware of any correspondence from the MNA at this point. That's not to say it hasn't reached my office and will be making its way to my desk. I'm not familiar with that right now. I would say that we have been trying with New Brunswick and PEI, like every other jurisdiction has been doing, to provide a safe corridor for those who need to get essentially somewhere, whether it's a medical appointment or otherwise. I think that would be as far as I would want to go today. I think that when we forecast out looking beyond our borders, I think that we have to, from a chief public health office in concert with the others in those provinces, to figure out a safe way forward, and if there is one there. But I think right now I wouldn't be any more comfortable expanding than what we have in place right now, and that would be subject to change down the road. But Heather, yeah.
I agree with you, Premier. I think just to be clear that the process right now is if someone is traveling from Quebec to the Magdalene Islands, they have a letter from Quebec saying that their travel, the reason for travel, and they're going through to the Magdalene Islands. The number is very small that are coming across the bridge. They are given very clear directions and instructions about going straight to the ferry in at one tip of our island. So I think that's the process in place right now, and we'd have to have the further discussions, which I have not had with Quebec at this time.
En français, s'il vous plaît, Dr. Morrison.
En français, OK. Je m'excuse. Bonjour. Alors, à ce moment, on n'a pas eu la chance de parler à Québec à propos de votre question, mais on est maintenant les gens qui voyagent de Québec, qui sont résidents de Québec et habitent aux îles de la Madeleine, ils montrent, ils doivent passer au Nouveau-Brunswick et à l'île du Prince-Édouard. Le pont a donné une lettre qui nous assure qu'ils habitent aux îles de la Madeleine, et puis on les donne des instructions de dépasser du pont directement au traversier, mais s'il doit arrêter pour prendre le pétrole ou ils ont le droit de faire ça, mais on les encourage de laver les mains, de faire attention, mais ils ne sont pas supposés d'arrêter pour d'autres raisons. Et alors, si ça va changer, on doit avoir des discussions avec Québec et aussi Nouveau-Brunswick.
Merci. Maybe another question for you, Premier. Along the same lines, one of the ministers from New Brunswick, Dominic Cardy, said that he wasn't looking at reopening the provincial borders for Nova Scotia and Quebec for the rest of the season, but he didn't mention specifically PEI. Should we read between the lines here that there is a strong possibility that your plan to reopen the bridge for New Brunswickers and Islanders will actually come through during the summer?
Well, I mean, I've said on here numerous times that we're certainly hopeful as we continue on this trajectory to find some way to have some some cross-border, travel between those two provinces. It would seem to me, being the non-medical professional here at the table, that would be the most logical place for us to start. But there are a lot of questions in that regard, and I do think we need to be open and looking toward what July brings. I mean, if you look really across Atlantic Canada, for that matter, when you take away the isolated cases and the horrible situation we've seen at the long-term care facility in Nova Scotia, Atlantic Canada has been doing relatively well. So I think we need to be mindful all the time looking forward. Dr. Morrison and her staff look at this obviously through the health lens, which is critical, and that's their job. And part of what I try to bring to the discussion from time to time is how we can also look at it from a social and economic lens, and how that fits in to the whole safety discussion. So a roundabout way of saying that I hope so, but I wouldn't say we're there yet. Heather? Dr. Morrison? Yeah?
I agree.
Okay.
Merci beaucoup. Thank you very much.
Merci. Thank you very much, and thank you to all of our Island media friends again for asking such good questions. So thank you very much.